Dr. Daniel Griffin.
And I'm Dixon Dupommier.
And today we're going to be discussing fever.
Indeed.
All right, so let's start off with a little bit of an introduction to what fever is. And a lot of stuff is based upon this book that Dixon and I are sharing.
Indeed.
We'll be looking at here. So let's start off, Dixon. So fever, are you familiar with fever? Do you know what fever is? Should we even be spending this time, or you feel like fever is something you got all under your belt, so to speak?
I've had fevers, if that's what you're asking.
Okay.
I've actually given a few too, but I mostly had them when I was a kid.
How did you know you had a fever? Did your mother told you? You measured something? You just felt like you had a fever?
It's funny. You wake up one morning and you've got a fever.
Okay.
Right? Or you go to bed and you wake up, or you don't wake up. You're logy and you don't want to get out of bed. You got aches and pains everywhere. And then your mother comes in and says, you've got to go to school, like Ferris Bueller's Big Day Off, except this is for real.
One of my favorite movies,
yeah,
Ferris
me too.
Bueller's Day Off.
Me too, and it's easy to fake a fever when you've got a thermometer and you put it next to the light bulb, and you stick it in your mouth. But I didn't, my mother used to use the back of her hand.
And sometimes when you had these fevers, would you go see the doctor, or mom was just like, it's a fever, don't worry about it?
Depends on how long it lasts, and how do you know you don't have a fever? Why don't you? That's the best part. No, I'm not kidding, because you wake up in a pool of sweat. You've gone through this feverish period of disease, and then somehow you've cured yourself, the immune system kicks in, and the next moment you're sweating like crazy. There's no better feeling in the world than to be over a fever.
Well, I always remember it, and it was Swiss Family Robinson, and it was there was a movie, right? There was the book, but then, and I think it was one of the first movies I was allowed to watch as a kid. And it was when I was introduced into, everyone was worried, and then, the fever broke.
Right.
And now everyone's,
how do you know it broke?
Now it's going to be okay.
That's right.
The fever broke.
That's right.
And so the issue with fever is a lot of times people come to the clinician, come to be seen because they have a fever. A lot of times they don't. And one of the decisions about whether or not to go to the doctor might be your context. It might be whether this is a new mother who has a baby with a fever, and they're not really sure what fevers prompt them to go to see the doctor. It may also be what part of the world you're in. If you're in an area where there's a lot of malaria, you may go to the doctor because you're not so much worried that your child or you yourself have a temperature elevation. You're worried that this is a sign of something more serious.
So interesting, because for that, when you mentioned malaria, of course, that was the first thing that came to my mind as well. I've never had malaria, but if I had had malaria, I'm sure I would have remembered, because one day you've got a fever. And then, of course, you wake up in a pool of sweat and you feel much better. I don't have a fever. 3 days go by, and the next thing you know, wait a minute, I've got a fever again. And so you get into these, they call them paroxysms. We'll talk about that too. I'm sure you'll give a better explanation than I will. But I used to lecture to medical students, and I could describe exactly what that fever cycle was with regards to the species of malaria that caused them. So that fever has been known about since the days of Hippocrates.
Well, I'm glad you mentioned malaria, and maybe I mentioned malaria. No, one of us mentioned malaria.
You mentioned malaria. I followed up.
But one of the important things when someone has a fever is to try to decide, is the fever a symptom of something benign, or is the fever alerting us to something more serious? So I always try to make the point that fever itself is not a disease, it's not a diagnosis.
That's right.
It may be something we want to address, but one of the first things we want to address as a clinician is this distinction between whether or not the fever is suggesting there's something serious that we need to know about, we need to target treatment for, or is this what we'll say is a benign fever, and maybe the fever itself is something we need to worry about because the underlying cause will solve itself, will settle itself.
We know that a lot of you out there are not in just one place all the time, and some of you are in South America, some of you are in Central America, the Philippines, Africa, Southeast Asia. Fevers are specific to areas, some of them. And so you have to be aware of what's out there first to know what the choices might be.
I remember a great lecture.
Is that true?
I remember a great lecture. Yes, it's true.
Okay.
I remember a great lecture I attended in, this was in India. And the lecturer was talking about how when you hear fever, you're not sure what people are talking about. And then he showed this wonderful slide with several types of fever. So one of the fevers was Saturday night fever, which is not infectious.
No.
Then he talked about beaver fever, but actually it was pronounced Bieber, Justin Bieber fever, which
Beaver
also is
fever.
not infectious.
It's true.
And then you really say you want to give it a context. And then there's fever that's in a malaria endemic region, and then there's malaria in non-endemic regions. So the context really matters. I think that the importance is going to be, I'm sort of reiterating, is that when someone has a fever, you want to be sort of getting that focus is what might be bringing them with this fever. So what could be the clinical disease, and are we going to address the clinical disease, or are we going to address just the fever? So let's talk about what is a fever?
Right.
Like what is normal body temperature? And I think that that's one of those things, and I ask medical students, I ask physicians on a regular basis, and they'll throw out a certain number.
98.6.
Which is
Fahrenheit.
So where did this? So I brought a chart along.
Oh, good.
And this is in our book, so people can look at this. And it's right as you flip the page after fever, and it allows people to go back and forth between Celsius and Fahrenheit.
Right.
And so 98.6 is going to put us right about 37 Celsius.
Exactly
we say,
right.
and I think we sort of like that because 37, that's a nice round number. We feel happy with that. But where does that 98.6 come from? We're all taught that in
Please
medical
tell
school
us.
in the United States.
I'm waiting with bated
is-
breath.
no, I love this story because it's based upon a study that was done, say, about 100 years ago. And it was published in The Lancet. And it was such an exciting study that they
By the way,
actually...
The Lancet is a British publication, so that should have been in centigrade rather than Fahrenheit, right?
So actually it was, which was great. And it was so exciting that they actually took the thermometers and they're in a museum in London.
Really?
And it's very exciting. But someone was creative and they
The
said,
British
you know,
Museum?
I don't know which British museum.
Okay.
But it was so exciting. And some people said, you know, we should check those thermometers. Because if we're basing all this on this wonderful, what if those thermometers are not accurate? And so they went and they checked the thermometers, and guess what?
They're not accurate.
It was like a 2-degree variation.
What was the fluid inside each one? Did they
so
differ?
it was mercury back then.
Not
right?
alcohol.
No, no.
Okay.
And so somebody redid the study.
Oh, wow.
And they say, you know, we should actually, you know, it's been
Check
it's
it out
been
just to
100
see that's
It's been 100
right.
years. We've been
What the
saying
heck?
that forever. It may not be true. And so so they redid the study. And now when I ask someone, what is normal body temperature? So we want to know this because fever is going to be, you're above normal, right? The answer really comes to, it depends. And it depends on
Okay.
several things.
Right.
One is, in general, if you take the whole average, it's a little bit lower than we were led to believe.
And is this true for children, middle-aged people, older people,
Well, so that's the it depends.
or not?
That's the it depends. So a couple things, sort of things to remember.
Okay.
Women are hotter than men. So the average body temperature of
We
a
all
woman
knew that.
is a little higher than a man. As we get older,
Yep.
we get a little bit cooler. I point that out to my children. So a person who's, let's say, 50, 60, 70, over the decades, you're going to see a little bit of a drop. So when someone who comes in who's 70 and they've got a temperature, we'll pick a couple off our chart. So when they've got a temperature of 100.5 or 38 centigrade, for them, that's a much higher rise than a 38 or a 101.5 in someone who's in their 30s.
So
Particularly a man. In
you're
their
talking
30s,
about
right?
core body temperature, correct? Can you distinguish between non-core versus core body temperature? Why do they always say core body temperature?
Yeah. No, and I think that's important because not only we throw these numbers out, but then you've got to ask, where are you measuring? Is this an oral temperature? Is this an axillary temperature under the armpit?
Exactly.
Is this
A rectal?
an ear? Or I that's one of my things. That's in my living directives. I never want a rectal temperature. And there's a couple of reasons why I don't. And one of the things is that the rectal temperature tends to be higher.
Really?
And so it triggers this diagnosis of fever. So
interesting.
you really probably want to subtract about half a degree centigrade, about a full degree Fahrenheit to get that temperature. But all the time you see people, ooh, temperature seems a little high. Let me check rectal to be more accurate. And the rectal should always be a little bit higher.
Higher than core
And that's
temperature.
going to throw, yeah. Well, no, that is the core temperature.
Oh, that is
So
the
when
core.
we're
So
talking
this is
about
not
our
core.
numbers, we're talking about oral temperatures.
Got it.
So most of the time we're thinking about, and we talk a little bit in our book about this interval range of different temperatures, oral being, this is centigrade, so you're gonna have to use your chart if you're a Fahrenheit person, 35.7 to 37.7.
Right.
So the range actually sits a little bit lower than that 37.8.
Right.
37.8 is a little higher, right? If we go to our tympanic, right, that's going to be our looking at our ear. That's
Sure.
pretty similar.
Sure.
Little slightly broader range. And we go to rectal, that's actually going to come up a little bit higher.
Got it.
And then axillary, again, is going to sit a little bit lower than our. So it's important to know when we're looking at these where we're measuring that temperature.
Right.
And now comes the issue of, I'm going to say there's two different thresholds for fever. There's going to be a threshold for fever diagnosis, as in there's a fever and I'm worried about you. There may also be a different threshold for you have fever and I want to treat that because I'm worried that fever itself can lead to complications.
Right.
Fever actually is, in general, I'm going to say, our body's natural response to protect us, and it is a large reason why we don't get so many fungal infections. The reason why we're warm and we can cuddle against our warm fellow human beings is thanks to the fungus, the developments pushing us. And so that's nice, when you ever, we always think bad things. People come in with mold, they're always worried about mold. I'm like, there's a good side to this whole fungal thing. So I'm not a big fan necessarily of, even the slight throwing say. And a lot of people use a threshold of, and we're going to use our chart again, 102 or 38.9 in limited resource settings of when to start treating that fever. Because below there, it might be uncomfortable, but you've got to sort of ask, like, how much of these antipyretics, these anti-fever medicines, do we really want to use?
So using fever as a therapeutic has also been used for neurosyphilis, as I recall.
A Nobel Prize.
As I recall.
Yes, the Nobel Prize
So the
was
spirochete
given.
doesn't survive above the core temperature.
Yeah.
And to raise the core temperature of someone with that disease, they actually had to give them malaria in order to get that to work.
Yeah.
And that was remarkable. I couldn't believe I heard that when I first heard it because it just didn't sound right, but it does sound right.
No, it was a Nobel Prize was awarded for giving someone with syphilis malaria,
So our
and the
temperature
fevers were high enough to cure the syphilis.
excludes organisms.
It
That's
is
what it
actually
does.
it is part of our immune response to clear parasites,
How
to
wonderful.
clear infections.
And
to,
raising the temperature increases our metabolic rate and therefore increases the amount of immune response we have towards a disease, maybe?
True. But unfortunately, sometimes the fever can get, we'll say, a little too high. Sometimes the body overdoes
Absolutely.
it.
What's the highest temperature you can survive and still be normal after you recover?
Well, we bring our chart up to about 105 or 40.6. That's when you start getting into a zone where people can start actually having permanent cognitive impacts from the fever.
Oh, wow.
Children can tolerate higher fevers
Yes.
than people
Yes.
who are older.
Yes.
Part of that, if you think about 105, 40.6, for a child who's younger, maybe female child, that isn't as big a level above, where you're talking about someone who's, let's say, a 70, 80-year-old male, and they're up at, that's really a big increase.
Right.
And so the risk of complications, and not only long-term, but immediate complications.
Wow.
Particularly in the young, we see seizures, febrile seizures.
Yeah.
In people who are of more advanced age, we see a lot of confusion, problems like that.
So we have a lot of diseases that end in fever.
We do.
We have dengue fever.
We have
We have
hemorrhagic
lots of
fevers.
fever.
I'm wearing my Ebola tie
We have
today,
Ebola fever.
Yes.
So most of these really serious diseases elicit fever.
Fever is a great warning. It's a great way of our body letting us know that there might be an infection. So what we'll do in a lot of areas that are high endemicity for malaria, so we'll say malaria endemic regions, is we'll make a first distinction. And this might be, let's say, as we talked a little bit before we started recording, Dix and I were discussing how a clinic is often set up in one of these places.
Right.
And you'll have people who are checking the patients in, and then you'll have people who are doing the vital signs. And somewhere at that zone, you may, if you're in an area with a high incidence of malaria, before they even see the clinician, you may send them for your malaria test. You may send them for the smear or your rapid malaria test. And if they're negative or positive, that's going to affect the triage from there. The positives might get pushed a little bit forward, so they're seen by the clinicians.
So when someone comes with a child and they say, my child has fever, who verifies that?
So that's a great question. Do you believe them is the question.
Right.
Like, how reliable is this subjective?
Of course.
And I have to admit, I've been in places where the clinician, I've got to check, And if you think about it, like your description of malaria fever,
Yeah.
if you show up the next morning without your fever, well, you're gonna discount that. But the studies have shown, I think, pretty clearly that you can trust people. People actually, other than I think my dad, who wasn't sure about what a fever was the other day when we were talking, people usually, particularly moms, have a good sense of what a fever is, what isn't a fever, and even without a thermometer, a sense of what's a high fever versus a low grade fever.
Right.
But then, as mentioned, we can do measurements. We can do oral, we can do under the armpit, axillary, we can do the ear, we can do the rectal in other people other than me, and actually verify if they're having a fever at that moment. But unless we have a period of time to repeat those measurements, we may not see it.
Exactly.
So it's important to not discount. Say, oh, you don't have a fever at this particular moment in time. If they had a fever.
So for many tropical regions and subtropical regions, fever is seasonal.
That is true. And the different things that cause fever are going to vary. In the United States, in temperate zones, we'll have our winter fevers, a lot of flu.
Right.
In parts of the world where there's a rainy season, once the rain starts, actually particularly in the early part of the rainy season, we see an increase in malaria.
Yes.
And then as we move through that, there actually can be times when we see either influenza itself or what we call influenza-like illnesses. So the fever's going to depend not only on where you are, but also the time of the year.
That's
yeah,
right.
Where and when you are.
That's really important to keep track of because when you make the diagnosis, let's say, of 2 or 3 fevers caused by the same thing, and the next person that comes in with a fever is diagnosed, the tendency is to say it's like those 3 things already. How many fever cases do you need in order to document an outbreak?
It actually depends upon the disease. So a couple things I think you brought up which are super, I think, interesting. One is when you go to a certain area to practice, you need to find out ahead of time what are the local diseases. Like going to a restaurant, what's on the menu? What do I need to be thinking about? And so if it's an area where there's a certain disease, you might be thinking about that.
Yep.
We'll use malaria again. It's a great parasitic disease that I think we all, it will be quite common, but we never consider it an outbreak, right?
So there are 3 kinds of malaria, right?
Yes.
Good.
But we're not going to talk too much about malaria.
I don't mean the
we're
species.
Gonna leave it, we're going to leave
I
it
don't
there.
mean the species. I mean whether it's continuous, discontinuous, or seasonal.
Yeah.
So,
but it is interesting, to think about, because we are, as much as we talk about fever, we'll get into different diseases, is we are making, we always think about, oh, I've got this one person in front of me, and what do I do now? And part of it might be thinking, what do I have to worry about? How do I make the diagnosis? And then focus that. The last, I think we should just talk a little about treatment. So we're not treating the specific, we're not discussing treatment of the specific disease, we're going to discuss treatment of the fever. And so the treatment of the fever, we use medications in a class we call antipyretics. Right. And in different regions, they'll be pretty similar in what we use. We tend to use a lot less aspirin these days than we used to, and part of it is a concern with something called Ray's syndrome. And this was when you give aspirin to people under 3 years of age, and they can actually develop this toxicity called Ray's syndrome. Not common, but devastating when it occurs. The majority of fever is treated with paracetamol, or acetaminophen, or Tylenol might be what you know it as. And this is weight-based in younger individuals. And once you get to an adult age, certain recommendations, a max of about 4 grams per day. So pretty significant amount. And then we might move on to ibuprofen or others, particularly in the adults, where we tend to really try to avoid the NSAIDs, non-steroidal anti-inflammatory drugs.
Now, you keep in mind that Dr. Griffin is speaking as though these drugs are available where you are. That may not always be the case. So what do you do when they're not available?
No, and I think that's good, is that, I quickly jump to those, but I want to reinforce, we really want to avoid using these medications when we can, for a couple of reasons. One is that, let's say this is a person, they have chicken pox, and you give them ibuprofen. That can actually trigger sepsis. That can have negative issues. Let's say, for instance, we have limited resources and you start realizing we're spending a quarter of our budget every month on acetaminophen. you may start saying, well, what are the other ways? And the other ways to do it, you can do cooling techniques.
Right.
You know, we talk about ice, but that's not always going to be accessible. It might be a moist cloth put on the forehead using evaporative things. But yeah, whenever you can, increasing fluid intake, drinking a lot of fluids, increasing breastfeeding opportunities for the young child. These are all different ways. You know, they sometimes come in with the kids all bundled up with the hat on because that's what, but with the fever, you may want to take that hat off. You may want to unbundle and let the ambient temperature cool the child a little bit.
Right. So
whenever you can, avoid using drugs.
You've got two approaches then, one for children and one for adults?
Same with adults. A lot of times the adults can use a cooling rag. They can drink more fluids. They can stay in the shade. They can stay well hydrated, things like that.
All right. Sounds good.
All right. Well, I think we've touched on all the important points here. And so thank everybody for joining us for today's talk.
You left one out, though.
What did I leave? Tell me.
You left out Peggy Lee, of all people.
Tell me about Peggy Lee.
Who says, you give me fever. I think she's probably talking to mosquitoes and to ticks and black flies. And when I hear that song, I always think of those things, typical parasitologist. But yeah, you should add that to your list of...
I will. All right. Well, thank you. And we look forward to seeing you again.